Okay, this is Brittany Jepp posting my health assessment video. This is the 360 tour. As you wanted to see, there was no aids or posters or anything on the wall guiding my health assessment. I'm gonna set the camera there for a moment.
Hi, I'm Jessie and I'm consenting to being on video for this assessment.
Okay, so coming in to see you, just performing some hand hygiene before touching the patient. So hi, my name is Brittany. I'm gonna be your nurse today. What's brought you in today?
I've had this cold that just keeps lingering and it's making my chest hurt.
Okay, I'm sorry to hear that you're feeling unwell. I just need to confirm who you are, as I've introduced myself so you know who I am. If you can just check, I just want to check your armband. And if you can just tell me your first and last name.
Yep, Jessica Nelson.
And when's your birthday?
February 17th, 1987.
Okay, perfect. So thank you for confirming that. Any past medical history? So any, do you have any asthma, any chronic conditions, health conditions that I should be aware of?
I don't have any conditions, no asthma. I get regular seasonal colds and sometimes sinus infections.
Okay, any allergies to any medications other than you said seasonal, but any allergies?
Not seasonal allergies. I'm allergic to penicillin.
Okay, and we'll make sure we don't give you that. Any medications? Do you take any medications at home?
I do not take any medications regularly, no.
Okay, perfect. And so I'm just gonna do your vital signs. I have a machine here. I'm just making sure that everything's okay. And I also, because you're coming in with a cold, I'm just gonna listen to some lung sounds and some heart sounds, if that's okay with you.
That's okay with me.
Okay, and this environment is nice and quiet, privacy, we have some curtains around us, making sure you're comfortable in this environment, and I give you privacy, okay?
Mm-hmm.
So if you're okay sitting the way that you are, I'm just gonna start by asking you a couple respiratory questions, just like some, breathing questions, and listen to your lung sounds, okay?
Okay.
Since you've had this cold, any shortness of breath when you're up and moving, where you feel like you can't breathe at all?
Not where I can't breathe at all. It is a little bit harder if I like to be physically active, so if I'm swimming or running, shortness of breath happens, but not to the point where I can't breathe.
Okay, any cough, any time where you're coughing up, it's called sputum, anytime you're coughing anything up at all, or productive cough?
Just what I would expect from a normal cold, like some mucus.
Okay, perfect.
Nothing abnormal.
Okay, perfect. Any smoking or anything like that, like cannabis or anything like that, cigarettes and stuff like that we should be mindful of?
No, I'm not a smoker.
Okay, perfect. So I'm just going to turn this way, make sure you can see. So I'm going to start with the diaphragm of my stethoscope, and I'm going to listen to your lung sounds on both the front and the back.
Okay.
And for each time, I will ask you to breathe in and breathe out, and we can stop at any point if you're feeling short of breath, okay?
Okay.
So I'm going to start just above the clavicle and listen for the apex of the heart. So I'm going to start on the right side and have you take a deep breath in and out. I'm going to compare it to the other side. Sorry, my hands are cold.
It's okay.
Breathe in and breathe out. And now I'm going to go down to the second intercostal space, mid-clavicular line, and I'm going to listen again in and out. And beside this is listening to the upper lobes on the left and right side. Okay, and I'm going to move down to the fourth intercostal space. And that listens for the right middle lobe, and then on the other side. And this is still the left upper lobe, as there's only 2 lobes on the left side and 3 lobes on the right side. And then I'm going to listen to the 6th intercostal space, and I'll just go below your breasts here.
Mm-hmm.
And it would normally be not on a shirt, but for privacy, we'll leave the shirt on. And 6th intercostal space on the other side. And then mid-axillary, we'll listen to the lower lobes on the left side. So I'll have you turn mid-axillary, 6 intercostal space. And I'll compare it to the other side.
Just turn.
Okay, and then I'm gonna have you turn around so that they can see the back side.
Okay.
You can just turn around, yeah, that's fine. Okay, so same thing on the back. We're gonna listen to all the lobes. So again, starting at the clavicle, we're gonna listen for the apex on the back side of the lungs. And you're still feeling okay?
Yes, I'm still feeling okay, thank you.
Okay. And then in and out. And then from C7 to T3, we'll be able to listen to the lobes on the left and right side. In and out. And these are all the upper lobe. This would be the middle lobe. On the right side, which will be now. And then again, it would be, this is for the lower lobes. And this would normally be on the skin, but due to privacy, we'll keep the shirt on. And then you can listen to the side here. And the side here. So all those locations, just to confirm, is you start above the scapula, just above the clavicle, to listen for the apex of the heart, and then between C7 and T10, or T3, sorry, is the left upper lobe and the right upper lobe, and then below would be the left lower lobe. The right will have a middle and lower lobe, and the left will just have the upper and the lower lobe, which we listen to there. And you can turn around now. You're still feeling okay?
I'm feeling okay, but I can definitely tell that I'm sick with all the breathing.
Okay, yeah, we'll take a moment there. And just to confirm, like I said, it was for the, if you couldn't see perfectly, the auscultation on the front would have been at the apex I listened to, and your breath sounded good. Equal inspiration and expiration. I didn't hear any crackles, no wheezing, which is good. It means you're probably on the end of your cold there. And that's about it. So when we were listening for the top, it was for the apex. And then, like I said, for going down, it would be the mid-clavicular line on the 2nd, 4th, and 6th intercostal space. And then the mid-axillary is the ones on both sides, just to listen for those lower lung bases. I'm also going to just have you take a deep breath in and out, and I'm just going to palpate for equal chest expansion. So again, when you take a deep breath in, I just want to see when you take a deep breath in and deep breath out, that my hands move symmetrically, which they do, and on the back side I'll just do the same thing.
Here, I can just
I'm just gonna hold here and have you take a deep breath in and a deep breath out, and it's definitely very equal, so that is good. Your respiratory assessment is good. Your O2 saturation was 98% and your respiratory rate was 16. And when I observed you when I first came in, I didn't see anything concerning. Your chest looks good, and when I watch you breathe, it doesn't look labored. It looks even, which is all good signs. Okay. The next thing I'm going to do is listen to your heart sounds. So again, this is just it's going to be feeling your pulses and listening to your heart sounds. So these ones, I'll walk you through what I'm doing. Any chest pain or anything that you've experienced during this cold that you have going on?
Just like the minor, like when I'm coughing, it obviously hurts more than when I'm just breathing or relaxing.
Okay, sounds good. And you didn't notice any swelling or anything like that, leg swelling, or anytime where you've felt that you're not able to breathe well and stuff like that?
No leg swelling or anything like that, and like I said, I've had to cut back some of my fitness.
Okay. No palpitations?
But no, nothing that's majorly concerning, just a cold that seems to be lingering longer than I'm used to.
Okay, and no palpitations, like heart, where you feel like your heart's racing, or dizziness, where you all of a sudden feel faint or anything like that?
No, nothing like that.
Okay. Well, your skin looks good. It looks pink. It looks nice. Looks like you're there's no concerns there. So, I mean, skin pink and warm. I can feel that you're nice and warm to the touch as well, but not too hot. Doesn't look like you have a fever. When I did your temperature, it was 36.7, so that's good. I'm now going to listen to your heart sounds. We're going to start on the right side, which you're good there. So the right side on the right sternal border here. So if you look for here in the right sternal border, this will be listening to second intercostal space. You'll be able to listen for the aortic sound. So you're going to listen with the diaphragm, listening for the lub-dub sound, which is the closing of the valves of the heart. And the S2 is slightly louder in this area. That's normal. And then I'm going to go to the left sternal border, second intercostal space, and listen for the pulmonic heart sound, which again, the dub is louder. And then we're going to go down to the third intercostal space for Erb's point, which is the in between middle part between the base of the lungs and the apex, or base of the heart and the apex of the heart. And here I can hear the S1 and the S2. S2 is still louder, and then I'm going to listen to the fourth intercostal space for the tricuspid heart sound, and I'll just lift your breast up here. Or sorry, that was the fifth intercostal space, sorry. And then the fifth intercostal space, mid-clavicular, and that will be listening for the mitral valve. And I can hear the S1 and the S2, and the S1 is louder, which is a normal finding. And your heart rate sounds regular. I don't hear an S3 or an S4 sound, so that's good. Your heart is doing what it needs to do. The next thing I'm going to do, I didn't hear any murmurs or anything like that, so that's great. So the next step with the cardiovascular assessment, which is part of everything that's going on, is to feel your pulses. So it's kind of a whole handful. So we can have you lay down if you'd like, just so that I can reach all of those. So have you, here, we'll just get this, lay down here.
Do you need the timer?
Sure. So I'm just gonna set a timer here to listen. So for each pulse, you should be listening for a minimum of 30 seconds. If it's regular, you can listen for 30 seconds. If it's irregular, the rule of thumb is to listen for a full minute. So we will start with 30 seconds and see with the timing, since we're at 14 minutes here, and just make sure that we get through. So we're gonna start here and start my timer here. So with the carotid, you have to make sure you only palpate one side at a time due to perfusion to the brain. So we'll just make sure you guys can see what I'm doing here. Maybe I'll bring this just a little bit closer here. Just bring this a little bit closer to you.
Okay. I can also hold it.
Yes. Okay. So the carotid, which is just here on the neck here, so we're gonna want to feel. So I'm gonna start the timer here, and we'll feel for 30 seconds, and making sure the patient feels okay. And like I said, you have to do one side at a time. And I'm counting in my head while I watch the 30 seconds. Feels normal. I call it, say, a 2 plus, because it's normal and it's not irregular. and it's not bounding. It feels like a regular pulse, which is a good sign. So with these ones you can't compare, which you can see, but you can't compare the two just because of where it is on the body. All right, so then you move down to the brachial pulse. So this is where you'll be able to do both. So let me just make sure you can see. So
I can stand up here.
yeah, I think if I do this, let me just move it up a little bit because we only have about 3 minutes left, 4 minutes left.
Do you want me to sit down?
Sure. So this is where we'll do the brachial pulses here. So this is where you can compare the two. You can feel here where there's an internal one, but you can feel the pulse in this area of the brachial, to feel for the brachial pulse. And again, just comparing the two, they feel equal. They're not bounding or anything like that. Perfect, and the finding is the same. It feels like your time's up by 2. Your heart rate is around 82 right now, which is good. And then we'll do the radial pulses next. So this is on the outside of with the thumb here, and you can feel the radial pulse here on both sides and comparing them. You're still doing okay?
Yep, I'm doing okay.
Thank you. Okay, and the next one is the femoral pulse. So this one, I might have to get you to lie back down briefly.
Okay.
So this is, and these ones are all kind of in the leg area. So the femoral pulse, again, you can compare on both sides. Sorry. You can compare on both sides, and it's kind of in the groin area. Again, normally it would be directly on skin, but due to privacy, I'm doing it over the pants. And again, your pulse feels normal. Okay, and then the next will be the popliteal pulse, which is just behind the back side of the knee. So we'll set the timer again, and I'm just gonna feel for the pulse in behind the knee there. We're almost there. It's been very consistent with all of your pulses, which is a good sign. And your skin feels nice and warm, which as I mentioned earlier. Okay. And then we're gonna move down to the dorsalis pedis pulse.
Top these off.
Mm-hmm.
Okay, this is my computer.
That's okay. And just to make sure that you can see this here, posterior tibial, which is here. So we'll do the posterior tibial first, and that's around the ankle area, inner side. Help if I started my timer. I'm running out of time. Okay, so since I see the time there, and then the last would be the dorsalis pedis pulse, which is just in behind your toes and just on the top of the foot there, and you would listen for 30 seconds. Okay, so everything sounds good. I don't see any edema, no swelling on the bottom. The cap refill on your fingers feels, I was able to squeeze your finger and it's about 1 second, which means that Everything is doing what it needs to do. I don't even know how to finish this. So everything looks good. It looks like it's just going to be something that needs to get better. So you'll just kind of wait it out, everything on my end. I didn't hear any bad sounds when I listened to your lungs. Everything on your heart sounds good. So it's just going to be taking it easy, getting lots of hydration, rest, and it should be getting better. But everything for my side is good, and the fact that you have no pain is also a good thing, because that sometimes can correlate. And at that point I would have had to ask you the PQRST scale just to figure out if we could see where the pain was coming from, but I'm glad you're not having pain. So I'll have the doctor come see you and just to do the final assessment before you can head home.
Okay, thank you very much.
You're welcome.